Good morning, everyone.
Good morning.
Okay, Miss LaJoy doesn't like it. The mayor's here. It's a press conference. We're fighting for children. Let's try it again. We're fighting for DC here, folks. Good morning.
Good morning.
There we go. Amen. Good morning, everybody. My name is LaJoy Johnson-Law, and I have the honor of serving as the Ward 8 State Board of Education representative on the DC State Board of Education. But I am here in the most important capacity of all as Abria's mom. Abria, can we say hi? Say hi, everybody. Hi. She's like, why do you have me up here? It's hot. So do you want to go stand with Miss Alexis and Mommy will finish it? Okay, Miss Alexis, can you wave? Yep, we're going to go stand with Miss Alexis. There we go. Okay.
Oh, thank you.
Thank you. Can we give it up for Bri, guys? She's I drag her everywhere. You know, I'm hoping the mayor can write her a school note for today. But seriously, I'm here as Abria's mom, and I want everyone to know that Abria is my miracle baby. Thank you, Madam Mayor. Abria is my miracle baby. She was born at 1 pound and 6 ounces at 23 weeks. Everybody go like this really quick. That's how big she was, guys. She's a miracle baby. She's 13 now, and she is thriving. But you know why she's thriving? Because of the hospital. You know why she's thriving? She's thriving. Miss Michelle, thank you. She's thriving because of children's. But you know what? You know another reason why she's thriving? Because of health services for children with special needs. Somebody say HSCSN? That's covered under Medicaid, baby. Okay? And so what I'm here to tell you all is that Medicaid, like so many children like Abria, we all depend on Medicaid. Many families just like mine. It really is a lifeline for us. It has been the difference between stability and crisis, between hope and despair, and honestly, and I really say this wholeheartedly, between life and death. Life-saving care. That's many of our children that have disabilities and other children who need life-saving care in this city. Medicaid has been a lifeline to us. So in Ward 8, well, the great Ward 8, and across the district, thousands of families are walking a delicate line every day. They're trying to hold it all together. Medicaid is that thread that keeps that line from breaking. And that's why I'm so grateful to stand here with amazing leaders, as we can all see, with amazing leaders to be able to defend health, dignity, and the future of our children. Because every child, and we all know this, but we want the world to know this, every child, regardless of their zip code, background, or ability, deserve the chance to be supported and to live a full, thriving life. Come on. Okay? All right? So now I have to pass the mic because they put me on a time limit, y'all. It is my deep honor to introduce someone who has never wavered in her fight for DC families, the incomparable Mayor Muriel Bowser. Let's give her a hand. And I thank you for the new hospital in Ward 8, Madam Mayor. Thank you.
Thank you, board member. Well, good morning, everyone. Please give our board member from Ward 8, Ms. Johnson-Law, a big round of applause and thank her and her beautiful daughter for putting faces to the life-saving care here at Children's National Medical Center. And I want to thank the entire team at Children's, led by Michelle Riley Brown, who you'll hear from momentarily, for hosting us today for this opportunity. We want to talk about why Medicaid is important to our city, to our kids, to our families, and to our entire hospital and provider community. I want to thank the health associations who are here, hospitals, our frontline health workers. Let's give them a big round of applause. Who are standing with us to push back against the devastating proposed cuts to Medicaid, and especially any proposal to cut the district's Medicaid FMAP. I want to acknowledge that we have been joined by so many people who are involved in this, who know the stakes, who can talk deeply about what the stakes are for our children and families and for our health care. I want to acknowledge our champion on the Hill, Congresswoman Eleanor Holmes Norton. Give her a big round of applause. I want to recognize our former mayor, Tony Williams. Give Tony a big round of applause. Members of the Council of the District of Columbia, you're going to hear from at-large council member Christina Henderson, who leads the council's health committee, at-large council member Robert White, council member Fruman, council member Felder, and council member Pinto. We want to thank them for being here as well. I know that many of us, or many who are watching and hearing today, may be hearing about this issue for the first time. So let me briefly summarize what's happening. We know that the Congress is looking to lower federal spending. We know that too well. And one of the ways that they are looking to do that is by reducing the federal government's share of Medicaid cost. And that's what FMAP means. It's the percentage that the federal government contributes to cover Medicaid cost. And for more than 25 years, the federal government has covered 70% of the district's Medicaid cost. Our FMAP percentages were not randomly chosen. It was set over 20 years ago by Congress in 1997 under Republican leadership, because they recognize that even though we function as a city, county, and state, unlike every other state, we have unique restrictions on how we raise revenue. What the Congress is now proposing, or may propose, is to lower our FMAP from 70% to 50%. So instead of the 70-30 match, it would become only a 50% match. So we don't want to just focus on percentages. We want to tell you what that could mean for health care for all of us. It will cost our hospitals, universities, and healthcare providers over $2.1 billion. Funds that support care for everyone in our city, including members of Congress, federal employees, including people who rely on Medicaid and Medicare, including people with private health insurance, everybody, including people in D.C., including people in Maryland and Virginia. These cuts would hit every hospital in the district, including Children's National, which is our shining example of pediatric excellence that is recognized certainly in our city, nationally, and globally. Children's, if you didn't know this, has a global reach. The results would be devastating and lead to hospital closures, longer wait times, cuts to life-saving services, and impacts beyond the healthcare system. You may not know this either, but Medicaid helps support some of our emergency responses to people experiencing medical emergencies who call 911. It would impact our police department's responses because people who are experiencing mental health emergencies wouldn't have medical care, but would need police response. And we know very clearly that that won't make D.C. safer, stronger, or more beautiful. We agree that waste, fraud, and abuse must be eliminated, and no one in our city stands for it. And that's why the district is responsible, and the district pledges to continue to be good stewards of taxpayer dollars. In fact, we were one of the first in the nation in the Medicaid program to require care provider ID numbers, a move that enhances transparency and roots out fraud. We work closely with our Medicaid fraud control unit. Our law enforcement partners in the IG's office prosecute providers who cheat taxpayers. But these cuts are not related to waste, fraud, and abuse. And the bottom line is this: if we want a cleaner, safer, and stronger city, we cannot undercut the safety net services that help us support public safety in our city. So we are here, DC, to urge Republicans to remove this harmful language from the reconciliation bill. We know that this is an issue that's important to us. It has been expressed in all 50 states. You've heard the President of the United States say that he doesn't want any cuts to Medicare. And we have to hold the Congress accountable for doing the right thing. We will fight for the district. We will fight to save our hospitals. We will fight to keep Children's National Medical Center the Center for Pediatric Healthcare Excellence that it is. With that, Michelle Riley Brown from Children's.
Thank you, Madam Mayor. Good morning, everyone. I am Michelle Riley Brown, President and CEO of Children's National Hospital, a nonprofit independent children's hospital located right here in Washington, D.C. Children's National is a top 10 children's hospital nationally, and we care for more than 250,000 children every year from all 50 states, D.C., and Puerto Rico. Approximately 55% of our patients are covered by Medicaid, making it a critical foundation for the high quality and highly specialized services that we provide. The proposed cuts would put care for kids at risk. Hundreds of thousands of children across D.C. and across the country are relying on us for health care. I have been a children's hospital administrator for decades, and I can tell you without hesitation that this is the most concerning threat to children's health care that I have seen in my 26-year career. The impacts would be immediate and devastating. If DC's FMAP percentage is cut to 50%, it would cost Children's National an estimated hundreds of millions of dollars. A cut of this magnitude would force us to make difficult decisions, including scaling back critical services. It would also jeopardize cutting-edge pediatric research and limit our ability to meet the needs of children in our community, across the country, and around the world. Cuts like this would also affect children with chronic or complex needs, where Medicaid plays a role in addition to their private insurance. To be clear, while low-income children who depend on Medicaid will suffer the most, these cuts would affect everyone who relies on Children's National, because these changes would fundamentally disrupt how we operate. To avoid these severe consequences, it is essential to maintain the district's FMAP at the 70% match, ensuring continued access to necessary pediatric health care services for all children in the District of Columbia and beyond. Thank you.
Next, Jacqueline Bowens from the DC Hospital Association.
Thank you, Mayor Bowser, and thank you, Michelle, and thank you, everybody, for welcoming me back home. I spent over 20 years here at Children's National, so it's great to be back home. And to the Deputy Mayor, I promise I will be brief, but I will be effective. We've heard a lot about Children's National, a place that's close to my heart, but I also want to reinforce to everyone, as been said, this is about everybody. It's about Children's National Hospital, but it's about every hospital. It's about every federally qualified health center. It's about every nursing home. It's about every home health agency. It's about every behavioral health provider. It's about everybody, regardless of your zip code, regardless of your socioeconomic status, regardless about where you live, regardless about how old you are. It's about everybody. So let's be very, very clear. It's not about others. It's about all of us. So I just really want to reinforce that. And so I'm glad to be able to be here to help reinforce what you've already heard and this opportunity to join you and all of our partners throughout the healthcare ecosystem today as we urge Congress to reserve DC's Medicaid funding. This proposal to cut DC's Medicaid program singles out DC and only DC, and that's wrong. It's unfair, it's unjust, and we cannot allow it to become law. You've heard about the potential impact on children, as I said before, and the impacts are just as stark for everyone. And I just really want to make sure we all have relatives, we all have family, we all have friends. Many of us around this area today, we've received the calls. We've come to the emergency room. You know, we know. And it's not just, again, as the mayor said, as Michelle has said, not just about health care. It's about public safety. It's about education. It's about all of that. And so some of us may be sitting here and thinking, well, you know, it's just about low-income people, and maybe it's about others. And for the congressional people who are watching us today, you know, take a moment and think about all those other aspects about health care and being in Washington, D.C., and how it will ultimately impact you. And let me be clear, again, these cuts will be nothing short of devastating to D.C.'s hospitals and our health care infrastructure. Health care in our region will be demonstrably worse for everyone who relies on our hospitals, and as I said, not just Medicaid recipients, everyone. D.C. hospitals, as has been mentioned, would lose $400 million, not just once, but every single year. That would mean a huge loss of doctors and nurses and serious cuts to vital services, including trauma care, emergency room care, maternity care, behavioral health, primary care, and specialty care. Every single patient we see, Medicaid or not, is going to have less access to care and longer wait times for the care that remains. And we don't know what that might look like. To those on Capitol Hill who represent Maryland and Virginia, this affects your constituents too. Nearly half of the patients that our hospitals see are either Maryland or Virginia residents. People come from hours away to seek care at D.C. hospitals. A cut of this magnitude would be far from isolated to just the District of Columbia. It would reverberate through the entire DMV region. There has been a lot of talk these past few months about making D.C. better and this beautiful city and safer. This change would undoubtedly make D.C. less safe. D.C.'s hospitals house trauma centers that are a key part of the city's ability to respond to terrorist attacks and other mass trauma events, including the anthrax attack on Congress and other mass trauma events, including the shootings that have occurred, 9/11, and most recently, the airline crash that happened. And what we do here in the district with our partners at the Department of Health is that we coordinate ambulance and fire departments. Also, they rely on Medicaid. And just as you can see, just the myriad engagement that happens. We also help with mental health and the homeless population. And these challenges will be even more difficult without the current funding that we already have. And so Medicaid, as has been mentioned, is a lifeline for all of us, and it's so critically important that this program not be cut. And so it makes us healthier and safer and a better community. But cutting Medicaid is not what is necessary or critically important. So as I said before, and what you continue to hear today, is that cutting Medicaid will make us less healthy, less prepared, and less safe. It is wrong, and Congress must reject this proposal.
Please help me welcome our Congresswoman Eleanor Holmes Norton.
Thank you, Mayor Bowser. Throughout my years in Congress, I have been a staunch supporter of Medicaid, consistently advocating for legislation to enhance its benefits for D.C. residents. I strongly oppose the proposed Medicaid cuts in the FY25 budget resolution, especially those targeting the federal match rate for D.C., known as the Federal Medicaid Assistance Percentage, or FMAP. Reducing D.C.'s FMAP would, from 70% to the proposed 50%, would be devastating for the nation's capital. It would create a $1.1 billion gap to D.C.'s local budget, an impact that would be catastrophic. A reduction in D.C.'s FMAP would destabilize our health care system and adversely impact the hundreds of thousands of constituents who live, work, and receive care in D.C. each day. The proposal to reduce D.C.'s FMAP is the latest in a series of attacks on D.C. The Trump administration and Republicans in Congress have consistently undermined D.C. from anti-home rule executive orders targeting the district to House Republican efforts to force D.C. to revert to FY24 spending levels by omitting a long-time provision in the continuing resolution. In 1997, Congress passed the National Capital Revitalization and Self-Government Improvement Act to help rescue D.C. from insolvency. The Revitalization Act transferred certain functions and costs from the D.C. government to the federal government, including pensions, courts, prisons, and community supervision of offenders. It also established the current 70% D.C. FMAP to reflect these obligations. Congress imposes several revenue limitations on D.C. For example, D.C. cannot tax income earned in D.C. by non-residents, depriving D.C. of more than $3 billion in annual revenue. Nor can D.C. permit buildings to exceed certain height limitations or tax its sizable federal property. These constraints are while our FMAP is set higher than many states to ensure D.C. can continue to provide vital services despite its restricted tax base. Cutting D.C.'s FMAP would not only harm our residents, but also federal employees, officials, and visitors from across the economy. It would jeopardize the care for children and families from all 50 states who come to our region's foremost renowned hospitals for treatment. To even consider these cuts is misguided and irresponsible. I urge my colleagues, particularly those on the Energy and Commerce Committee, to reject all Medicaid cuts during budget reconciliation, especially our reduction to D.C.'s FMAP. The stakes are too high, and providers and patients and our region cannot afford this. Thank you very much.
Okay, I want to also acknowledge that we are joined by our Deputy Mayor for Health and Human Services, Wayne Turnage, and our Director of Health, Dr. Ayanna Bennett. Please give them a round of applause because they are the leaders in our government who, if this happened, would have to figure out how to save our hospitals with our hospital partners. So our last two speakers are Chief John Donnelly from DC Fire and EMS, our fire chief, and our council member at large, Christina Henderson.
Good morning. Thank you, Mayor Bowser, for your leadership, and Congresswoman Norton for your service to the district. I'd like to take a moment to recognize Children's National Medical Center, where we transport many of our youngest patients. Without them, we would be in a very bad place. I'm John Donnelly, Chief of the District of Columbia Fire and Emergency Medical Department. I also carry the title of the CEO of one of the largest healthcare organizations in the district. Right? We got to remember that. I'm not just the fire chief. And I'm sort of angry that I'm up here today to have to defend a budget that people are trying to make harder on us. It works. We provide great care in this city, and they wouldn't do this in their home jurisdiction. They wouldn't do it in their home jurisdiction. So we respond to over 500 calls a day. We handle everything from cardiac arrest to stroke calls to people with complex medical emergencies, the kind of people that need to be in hospitals getting great care so they can have a good quality of life. With our partners, we all make a difference. Cutting Medicaid funding will not only disrupt our healthcare ecosystem, which includes the emergency medical services, but it will provide a negative effect on everybody. It will reduce our resources. And if we do that, no matter who you are, the effect is blind. So be careful with this cut, Congress. Be very careful with this cut. Last year alone, the department treated and transported nearly 78,000 patients to local hospitals. 43,000 of those patients, or 56%, were Medicaid insured. These patients included 3,000 children, many of whom came here to Children's. And we also transported over 8,000 seniors. Medicaid payments fund almost $1 out of every $3 for providing EMS services to all patients in the District of Columbia. Overall, providing EMS service to the public costs approximately $274 million. Medicaid funding helps us purchase many of the life-saving tools that we have, including ambulances, the whole blood program, medicines to help with overdoses, medicines to help with asthma, medicines to revive your heart if it stops. Our firefighters, EMTs, paramedics, and officers are industry-leading professionals that need the resources to do and provide the services that our community needs. DC Fire and EMS is committed to respond to every call for emergency medical care because our DC values demand it. Medicaid funding ensures that we have the resources we need to deliver the right care at the right time to those who need it most. Thank you.
Thank you. Council member.
Thank you, Mayor Bowser, and thank you, Michelle, for hosting us. I have two little kids. We've been to Children's ourselves and have received excellent care. A lot has already been said, but this is what I want to drive home. We've seen some of the talking points that have been circulated on the Hill that have been sent to lobbyists and what they refer to this as normalize DC's FMAP. There's nothing normal about cutting people off of their health insurance. There's nothing normal about cutting pediatric health care. There's nothing normal about bleeding providers dry so they have to shutter hospitals that potentially have been around since 1862 providing service here in the nation's capital. There's nothing normal about starving the EMS of the nation's capital for funding and resources, especially when we support so many public events that occur here in the federal partnership. There's nothing normal about closing nursing homes. There's nothing normal about telling schools that they can no longer bill for Medicaid services. There's nothing normal about telling individuals who are suffering from substance abuse disorder that they cannot receive care because they can't afford to do so. So much progress has been made in public health in this country and the nation's capital in the last 20 years. Why go backwards? To have someone get a tax cut? Because that's really what this is about. Care versus tax cuts. So as the chief said, they wouldn't do this in their own jurisdictions. I've heard a number of members of Congress who have said, they don't want to see any cuts to Medicaid. They want to protect insurance. That should be the same case for the District of Columbia, where you have decided that we are not a state and therefore can't advocate for ourselves. And so I hope that our friends and neighbors keep that close. I do want to thank the congressmen from Maryland and Virginia who did send a joint letter on behalf of the District of Columbia talking about the regional impact. Because as Jackie said, this is not just about individuals who are on Medicaid. If a hospital is getting cuts, it doesn't matter if you have private insurance. You will feel the impact as well. So thank you so much.
Thank you. Thank you, Councilmember. Okay, so you've heard about the impacts, and you've heard about how our system is serving all 8 wards, is serving Maryland and Virginia, is serving visitors who come to the nation's capital, members of Congress, their staff, and they deserve quality care. And so we just want to make it very plain that these cuts would be real cuts that would force reductions in services. So I'm going to give anybody an opportunity who wants to step away, because I know it's hot there, but we'll take a few press questions on topic. Yes.
Mayor, we talked about the CR, and maybe there was a misunderstanding. That's why D.C. faced the $1 billion cuts. But now we're talking about another potential $2 billion in cuts. Do you feel like this is another instance of a lack of knowledge in what D.C. can and can't do with taxes, or is this a direct attack on the district?
Well, we're the only one that appeared on a list that would change our match. And you heard the language that the council member referred to, calling it normalizing it. There's a reason why the district is treated differently. It was negotiated in good faith. It's in law by Republicans, I might add, who recognize that we're different. Now, until we become a state, we're going to be different. And unless we are able to tax more of our property, like the Congresswoman mentioned, raise the Hyde Act or tax workers, we have a delicate balance with our budget. And this, on top of a changing economy that is changing largely because of federal decisions, would be devastating to the city. Yes.
Can you give us a sense of the timing here? Obviously there's a moving target on when reconciliation would pass, but when it passes, are we talking come the fall, you guys would have to address what's in the 2026 budget, or is there a year lag before it would kick in?
I don't know that is entirely clear, Martin, so I can't answer that, but we got to not get there. And that's the point of why we're here today. And I think that the pressure from around the country is mounting. I think when we called this press conference, we thought a vote could happen as early as next week. Now we're told it's a couple of weeks out. So I think the pressure is mounting. This is not a red state, blue state issue. This is a issue of, do we want to have quality health care in the nation's capital or not? And we do. All Americans want that. We want it. The region wants it. America wants it. And there's really no reason to change it. And we know the stated goals of what the Congress is working on now. To this committee in particular has to close a certain number gap. This would be a drop in the bucket. This change for the federal government wouldn't close any gaps, but it would close hospitals in the district. Yep.
We know the timeline when it comes to government and Congress, but just for families out there that are listening and watching, they have Medicaid, they rely on this. God forbid this does happen. What is the timeline for them and their families if they are impacted by this?
I just said we really can't say at this point because we don't know what the proposal really is or how it's going to end up, and we would have to see the language and the law. Yes.
Mayor, it was pretty clear that everyone will be hit by this, but can you talk about how this will be, the potential cuts would be distributed among all the health agencies in the district?
Well, I'm going to ask Michelle to speak specifically about children's.
So, as I said earlier, the impact would be devastating and immediate if the proposed cuts would go through. I can tell you that our emergency center visits, 70% of the visits that come through are covered by Medicaid. One of our highest hitting and most impacted inpatient units would be neonatology, and we have number 1 or 2 in the nation. Our NICU is ranked number 1 or 2 in the nation consistently every year. So the impact is immediate, it's broad, but I can also tell you that it just doesn't stop there. We would have to look at other critical services, and everyone would be impacted because Children's National would have to scale back services. And then it's just not people on Medicaid. It's everyone who relies on Children's National specialty, high specialized service that would be impacted.
Okay. Who hasn't asked? Yeah. Yep.
Mayor Bowser.
I'm sorry. Before you go, Jackie wants to add.
Thank you. And again, as has been said, we don't really know specifically, but I will say that there are certainly a number of our hospitals who have a disproportionate amount of Medicaid as their financing sources. So certainly, given that the impact to them is going to be felt quicker and harder and faster. So given that, we certainly know that they would certainly have to begin to think hard about those services that they would have to think about reducing or eliminating, and that's going to cut across the board. And then I do want to say, it's a domino effect. So when one hospital has to pull back, it's going to then have a trickle over impact on others. And I'm talking about emergency room backlogs. I'm talking about elimination of services. So while one may have a disproportionate amount of Medicaid, it then does impact everyone. So as I was saying earlier, we can't think because one hospital is disproportionately Medicaid and another one may be in another part of town that they would somehow or other be immune to it. So it's going to affect everybody.
We'll take 2 more given the heat here. Yeah.
Mayor Bowser, maybe this is a question for Mr. Turnage, but I've heard 2 numbers, 1 billion, 2 billion, and I think in your one sheet it says the cuts would be 1.1 billion, but would result.
Yes.
Can somebody explain
sure.
that?
Let me.
I appreciate that.
You got the right person.
Thank you.
Thank you. There are 2 FMAP reductions potentially for the legacy Medicaid program, not the Obamacare expansion. If that goes from 70 to 50, they will extract about $713 million out of the district's Medicaid program. If they take the Obamacare expansion group from 90 to 50, that's another $373 million. You combine those 2, it's a $1.1 million withdrawal of federal dollars. $1.1 billion withdrawal of federal dollars. So the question is, can the district replace that $1.1 billion with local funds? The answer is no. So that means you will have less money locally to purchase the services that we need to purchase. So we now have a program that is estimated to cost at the end of this year $5.2 billion. If we lose the legacy match and we lose the Obamacare match, that's $1.1 billion. Our local match is $1.6 billion. We can only have a program of $3.2 billion at that level. That means we would go from a $5.2 billion program to a $3.2 billion program. And the last time Medicaid has been funded at that level, I think it was 2017. So that gives you some indication of how devastating the cuts would be.
Thank you.
Okay, last question here in the
Thank
front.
you.
Okay, and then one more. Okay, yes,
Okay.
1, 2. Yes.
Jenna Portnoy, Washington Post.
Yeah.
You have been to the Hill to talk to lawmakers. Have Republican lawmakers been, in the House especially, receptive to your message?
I would say yes, they're listening and responsive. They understand the unique status of the district. They understand the 1997 agreement, and they understand that this would devastate hospitals. So I think we have to make sure that the politics don't prevent them from doing the right thing.
Quickly follow up on that.
Yeah.
Just to quickly follow up. DC residents have stood up for the district recently over budget matters. Is there anything you would want residents to do in this circumstance?
I think DC residents should stand up. This is a real threat to their lives, their health care, and the health care system. Absolutely. They need to talk to lawmakers. They need the hospitals to talk to lawmakers, and the children need to talk to lawmakers. You heard the council member say, like, this affects schools. This affects all of our services, including our nursing homes. And so everybody needs to be talking and recognizing the impacts. Yes, last question. Yes.
News. In terms of the knock-on effects, you just opened Cedar Hill. People there eager to see services east of the river. Does this put a serious crimp in what they're able to do? Because you were talking about how one affects the other, correct?
Sure. Wayne?
Thank you. Fortunately for Cedar Hill, they have a contract with the district that guarantees a certain rate. And we guarantee that rate because they are serving a population that is disproportionately Medicaid. If you give them a normal, the rate that we regularly pay other hospitals, they would eventually close because 90% of the residents in Ward 8 are on Medicaid. So they have a contract that specifies the rate that they must get. If the Medicaid match rate drops, that increases the cost to the district.
And a quick follow-up on this. When you said DC residents should stand up, what form should that take? People want to know what really works.
It's not just DC residents. Like I said, everyone needs to stand up. Now, oftentimes I used to work on the Hill. I was a staff assistant, so I took the phone calls too. But if I have to break your phone lines to get it across, blow them up. If we have to go knock on their doors and be in their halls, then we need to do that as well. All of the members of the House Energy and Commerce Committee have a vote. All of the members of the House Energy and Commerce Committee have a responsibility to determine what they're voting on and what is the impact. And to just say, oh, I don't know about the DC issue, that's not an excuse. That's not an excuse. So I hope for residents in the region, because this is a regional issue, but also nationwide, because I looked at the list of all of this, all of the other states, their FMAPs are calculated annually. If they do some other things on this proposal, like dropping the floor, so everyone is guaranteed right now a minimum of 50%, but if they drop it, we've got some other states in this country who will go down to 38%, 37% in terms of their federal match. So everyone needs to be talking about this, because do we really want to go back to the places where folks had to wait to receive care until there was a clinic, and then you had a line down the street of folks trying to get dental care or trying to get basic services and putting off these surgeries? We don't want to do that. So email, call, show up, knock on doors, go to the town hall meetings. Don't let them get by saying, oh, we didn't know. You knew.